Alright everybody, part 2 of the Platinum Planner training for preceptors. This will be more applicable to you, but in the first video I wanted to make sure that you saw what the student was entering, what they had the capabilities of, and their process of going through it. So go to platinumplanner.com like you normally would, log in your information here, click sign in. In this case, again, I've got a different dashboard. When you sign in, you'll actually just go right to this page, and it'll tell you here how many students you have with documentation to approve. Most of you only have one student at a time, so you'll see one student with documentation to approve. But this will give you your indicator of whether you have documentation or not. Now the way it's set up, and it's not a hard timeline, I haven't been able to find a way yet to make it a hard timeline, but they should have their documentation done and submitted within 48 hours. We're trying to figure out a way to make it a requirement that if it's not done and submitted within 48 hours so that it's available for you on your next shift, that they just don't get credit for that. Make it a little bit more accountability, and also we don't want this dragging on forever. We have had some students drag this on and they wait a month to put in their documentation, and then literally nobody has any idea what's going on or what that call was maybe a month ago. Alright, so let's go ahead and click on this so we can view the documentation. These are ones that were submitted to me for different purposes, but up here you see the student, that's me, the opportunity that I just made on the clinical date of July 5th. It all defaults to this 12 a.m. time, but it actually shows the actual time that they did their clinicals here, from 1,400 hours to 2,200 hours. Be careful about flagging this. If you have a discrepancy with it, you'll be able to go in and approve it or not approve it in a different way. But if you flag this, it actually completely locks the student out of Platinum until I unflag them. So that's like the nuclear option, so please don't do that. So we want to complete this clinical. Okay, so what pops up is what I've entered on the previous video that you saw, just pops up in a different window. So I did my field internship at Bloomington Fire Headquarters from this time. These are the amount of hours. This is the actual time and date that I submitted it, and it tells me that the due date was at 10 o'clock on the 7th, so it's 48 hours from when I did my clinical, when I ended my clinical. Scheduled start time, scheduled end time, my actual. Okay, so you see here I scheduled it from 2 to 10, but we ran late, so I went from 2 to 11 instead. Preceptor name was me. This will actually obviously have your name. It'll show a review status, so this has not yet been reviewed by a preceptor. Here you see the call, time of call, age, type of patient, information about the call, it was a chest pain patient, and the skills. And you see here next to the skills it says observed, successful, or attempted. So I observed an assessment of adults, only because I forgot to change that to successful. I did successfully treat the patient, but I was not able to get IV access. Then down here they've got their shift evaluation and self-evaluation. Okay? There will be one of these for every call. If they have 5 calls, they'll all show up here, typically, and then the shift evaluation and the self-evaluation will be underneath all of their calls. So there's an ALS call, chest pain, things I did successfully. I was able to assess and plan the treatment plan of a chest pain patient. Comments and immediate plan for next contact. Talks about, it kind of duplicates the same things here. I rated myself as competent on all these things, and again, you'll get a chance to rate them as well. Additional comments. I didn't write anything down, comments on any unsatisfactory ratings, so had I said that I was unsuccessful on the physical exam or something because I forgot, they may comment down here that says, I forgot the physical exam, I need to make sure that I'm not forgetting this in the future. And then their overall plan for the improvement on future shifts. There's no preceptor review of the student site. That's because we haven't done it yet. An opportunity event log just shows when they created the clinical and when they submitted the documentation for review. Okay, so I like what I see so far. I believe that they wrote this shift and wrote these hours. Okay, so I'm going to approve it. However, if you have no recollection of this or whatever else, then here is where you can reject it. If you want to print it to evaluate and review it later, you can do that as well. or if you click return, there's stuff in there that shouldn't be, or they forgot stuff that they should have put in there. It's not so much your job to make sure that they put in everything that they should have, but if they put in extra stuff, you can return it, write a note that says why you returned it, and it'll send it back to the student for them to resubmit it. So in this case, I like it, so I'm going to approve it. Now here is where we get to approve or rate the student. Okay, so in this case, patient interview and history gathering, they said competent. I think it needs work. Actually, across the board, they did it. They got there, but I think they need more work. Except for professional behavior, they did fine there, and they didn't do a team lead, so it's not applicable. So here you view the students' comments. Immediate plan for improvement on the next contact. Here's where you can type yours. Okay. Accept that. Check this box. I'm applying my initials to this document. That's basically saying that you wrote it, that you're good with those comments. You also have the opportunity to comment on any unsatisfactory ratings or discrepancies, so why you gave them these ratings. And overall plan for improvement. Write feedback to them as far as what they need to do to be better. Again, those are not visible to the student right away. That's feedback that I will give the student, so it's confidential until it needs to be passed on. Student reported that they were on time, well-groomed, in uniform, and prepared. Were they? Yes or no? Student knows equipment, location, and use. Yes or no? Behavior was professional. Click all that apply, or unselect all that apply. Same thing with these here. Helps clean up and restock unprompted. Student asked relevant questions. Student left site early. Did not complete the shift. If they did, and it wasn't because you cut them loose early, then right, yes, they left early. We'll deal with it on a case-by-case basis, but things do come up, so we understand that. You can have this box checked if you want the teacher to contact you, if it's something that you immediately need to talk about. Otherwise, you're going to accept this saying that you evaluated them, and that's your electronic signature. And we're going to submit. So now the preceptor gets to complete this evaluation of the student. Were they on time? Sure. Was an appropriate uniform? Sure. Prepared for the clinical site? Yeah. Open to learning? Yeah. I am going a little bit faster here. I'm just trying to hit the 15-minute timeline so that I don't have to do another video, and you don't have to take up more of your time watching this. Then there are affective objectives. This is the back of the form that you guys are filling out now. I just made it electronic, so the student fills out the front, you fill out the back, and sign it. So that's not a new form; it's just electronic. So if you have questions about this, then you can just refer to that form for now. But it's the same issued McLean County Area EMS form. You do have to rate them. If you can't rate them, put no opportunity to evaluate. You can add any questions. There's your electronic signature. There's the date. Okay. And we are going to submit. And this is trackable. We are tracking this electronically through Platinum Planner. The grading scale for call management. In this particular scenario, I didn't get any call management, so these are going to be 1s. Remember, 4s are your highest rating, 1s are not applicable or your lowest rating. Again, this is the same information that's on the call management form on paper. We're not doing anything new, it's just electronic now. We're trying to move everything electronic, so this form doesn't technically have to be filled out anymore on paper. Any preceptor comments, and by checking this box, you're certifying that the information is true and accurate. Okay, so we're going to submit that form. And then we're going to do the clinical evaluation of the student. Okay, non-judgmental in treating patients. 5 is outstanding, 1 is unacceptable. So 5s across the board. You have the opportunity to write comments. Again, those comments are not visible to the student. If you ever want to see the difference between the student form and the preceptor form on what they can actually see once the documentation is done and approved, I've got examples of those that I can actually submit to you. If you're worried about confidentiality or what they can see, what they can't see, what you want to write, what you may not want to write, based on feedback if they are or are not going to see it. So if you want that documentation, I can get it to you as well. Finish these here. Message for instructor. Okay. If you want to put something in there for me, then you can. Any other comments for the candidate? One thing I forgot to mention, as long as your guys' spam filter doesn't filter it out, you will get an email to your city email that says approval request, so-and-so at McLean County Area EMS System has submitted documentation for your approval. And it comes through from Platinum Planner, so you should get notified when that's ready to be approved. So we've done this form, we're good, we want to submit it, and we're done. So obviously if you're going to type in comments and feedback and things like that, it does take a few more minutes. And if you've got several shifts to approve, it's going to take some additional time as well. But it really doesn't take that much longer to do these. I know right now it is double paperwork. You got to fill out the paperwork side of it. I'm working on trying to get these forms up. But I'm sure, as you guys can understand, we had to make sure that this system worked the way we needed it to and was going to track the way we needed it to. And as an explanation of why we use this system, we have to have it for accreditation. Our program is accredited, as you guys know, and we have to have an online tracking system that's able to track these things and print out reports of student status, where they're at with everything, and whether they've met all the requirements to be able to sit for national exams if they choose to do that. So that's the reason we went to this. It was a necessity. This is the best option for it. There were a couple others out there, but they were not nearly as robust. Platinum Planner, for those of you preceptors that don't know, does have a mobile app. The mobile app is free, and they made some significant changes over the last few months to it. So initially it came out that only students were able to document things on it. Now they've adapted it and changed it so that as a preceptor you can go in and actually approve and review the documentation from your phone. By no means am I implying that you have to do this from your phone. It is just an easier, more convenient way to do it. Nor am I advocating that you should do this on your days off or anything like that. If you choose to, that's up to you. But it is set up so that if your patient or your student rather is keeping track of everything throughout the shift, you can go in and approve it, right from your phone or computer right as soon as the shift is over with. As with anything else, if you have any questions, feel free to reach out to me. I'll be happy to answer any questions. If you forget anything, I can log in as any of you. We can view the same screen and we can review it together. If you lose your password, username, or anything like that, I can get that stuff reset for you. As a reminder, your username is going to be your city email, and your password by default is password until you go through and decide to change it. But again, I can go in and change all that stuff for you. If you're watching this video and you're not yet a preceptor and need to be added to the list, go through the appropriate channels and I will get you added so that you've got access to this as well. I think that pretty much does it. If I forgot anything, please reach out, ask questions. I hope you guys found this helpful, and I hope it cleared up some of the mud in the water as far as how to go through things and what the expectations actually are. So thanks for your time, and reach out to me if you guys need anything.